There are several risk factors for pulmonary edema, a condition in which fluid accumulates in the lungs. Heart conditions such as congestive heart failure, hypertension, and coronary artery disease increase the risk. Lung diseases such as pneumonia, as well as exposure to toxins such as smoke or high altitudes, can cause it. Other factors include kidney disease, certain medications, and high-altitude physical exertion. Risk factors. Heart failure and other heart conditions that raise blood pressure raise the risk of pulmonary edema. Heart failure risk factors include arrhythmias or irregular heartbeats, using alcohol, heart defect at birth, coronary artery disease, CAD, diabetes, valve disease of the heart, blood pressure that is too high, obstructive sleep apnea. Some nervous system conditions, as well as lung damage from near drowning, drug use, inhaling smoke, viral illnesses, and blood clots, increase the risk. Traveling to high-altitude locations above 8,000 feet, about 2,400 meters, increases the risk of developing high-altitude pulmonary edema, HAPE. It usually affects those who don't give themselves enough time, a few days to a week or more, to adjust to the altitude. Children who already have pulmonary hypertension and structural heart defects are at a higher risk of developing HAPE. Complications. The complications of pulmonary edema are determined by the cause. In general, pulmonary edema can cause an increase in pulmonary artery pressure, pulmonary hypertension. The heart eventually weakens and fails, and pressures in the heart and lungs rise. Preventions. By managing existing heart or lung conditions and leading a healthy lifestyle, you may be able to avoid pulmonary edema. Controlling cholesterol and blood pressure, for example, can help reduce the risk of heart disease. To keep your heart healthy, follow these guidelines. Consume a balanced diet that includes fresh fruits and vegetables, whole grains, fat-free or low-fat dairy, and a variety of proteins. You should not smoke. Get some exercise on a regular basis. Limit your intake of salt and alcohol. Control your stress. Control your weight. High-altitude pulmonary edema, HAPE, prevention. Ascend to high elevations gradually to avoid HAPE. Although opinions differ, most experts recommend increasing elevation by no more than 1,000 to 1,200 feet, 300 to 360 meters, per day once you reach 8,200 feet, 2,500 meters. To help prevent HAPE symptoms, some climbers take prescription medications. Start taking the medication as per doctor's advice at least one day before ascent to avoid HAPE. Also inquire with your doctor about how long you should take the medication after arriving at your high-altitude destination.